Hi guys, today we'll be talking about some of the risk factors for developing plantar fasciitis. These are some of the things that make you more likely to develop plantar fasciitis or heel pain from running. The first one is high impact. I've talked about impact a lot. If you land with a harder strike, you increase your risk of quite a few different kinds of injuries, and plantar fasciitis is one of them. So if you go to my website, you can check out some of the blogs on running more softly. I'll link them in the description, but that's something you might want to consider if you want to reduce your risk of developing the problem, or you want to try and treat the problem if you already have it. The next risk factor is a stiff ankle or a tight calf, which is effectively the same thing, because what happens is it reduces your range of movement in something called dorsiflexion. That's when you're sitting down with your legs outstretched, you're pulling your toes up towards you. That movement of the ankle, that we call that dorsiflexion. If you have less than 10 degrees of dorsiflexion, you're at an increased risk of developing plantar fasciopathy. If your knee to wall test, right, so that's when you put your foot down and you take your knee in to touch the wall and you see how far away you can get your toes from the wall. If that is less than 10 centimeters, again, you've got an increased risk of developing plantar fasciopathy. Treating those things, we're going to talk about in the next video. The next risk factor is to have a high BMI. If your BMI is above 25, there's a twofold increased risk of plantar fasciitis. If it's above 35, it's a fivefold increased risk. That can be incredibly frustrating for people who are trying to use running to help manage their weight. And in terms of diet, I'm not really qualified to talk about that kind of stuff, but there are a bunch of things you can do from the training habits standpoint. So if you visit the link in the article below, it'll talk a lot about strategies that you can use to help reduce your risk of developing any kind of running injury, and that's even more important if your BMI is above 25, because unfortunately you just are at a higher risk, and there's no two ways about it. The next risk factor is to have flat feet, to have a slightly pronated arch. Now this is very muddy water indeed, and I will be talking about in the next video the muddy water of orthotics and whether that's a good thing or a bad thing, whether arch support is necessary or not. I will talk about that in more detail in the next video. Another risk factor is to spend all day on your feet. So if you are a policeman, if you work in like Costco or something like that, where you work in a warehouse, basically any job where you just spend all day on your feet, particularly on hard surfaces, those people develop plantar fasciitis at a much higher rate, and many of those people are also runners. There's not too much you can do about that in terms of you have to work, you have to earn a living, right? So, but you can try and just insert into your day tons of little breaks of like 1 or 2 minutes where you sit down and just get the weight off your feet. Some employers will put in padded surfaces and things like that to try and cushion the floor, and heel cups is another intervention people use to increase the sort of squishiness of the surface they're standing on. I don't know how well those interventions work, but it's not going to do it any harm, so it's kind of worth a try. They noticed in factory workers and people like that who spend a lot of time on their feet, those who wore the same shoes every day actually had plantar fasciitis significantly more commonly than those who didn't. So we can take from that, if we rotate our running shoes through the week, so we have 2 or 3 pairs of running shoes that we just kind of cycle through, we may help reduce our risk of developing plantar fasciitis. And I've written an article before about how it actually seems to reduce running injuries, all over, just to change your shoes up, because it likely just changes the way you run a little bit and changes the stress points in your particular pattern. Okay, so stay tuned for the next video, and we'll dig into a little bit more in the treatment side of things and what you can do.